We all know that we need them, and we want to make sure that they know that we appreciate their work.
But at the moment, nurses in mid-Michigan are feeling overworked. They're caught between the proverbial rock and a hard place, putting in more hours because of the pandemic, but with less help because of a shortage of workers.
And a study in the Great Lakes Bay region shows those factors are taking their toll. TV5's James Felton with the alarming results.
There's nightmares, there's stress. I don't think anyone is sleeping.
Working in healthcare is definitely a marathon.
You don't get enough sleep, you're not eating.
There's days that I don't even get a lunch.
How do we start caring for those that we depend on to care for us?
That question is what inspired Shelby Rancour, a graduate of Saginaw Valley State's Master in Public Health program, to conduct this study of health status and health behaviors of nurses in the Great Lakes Bay region. Rancour gathered responses from 347 nurses taking part in the anonymous survey from April to July of 2021. A majority of the participants were married white women between 30 to 39 years old. She tells us some of the results were alarming.
Over 40% of the nurses who responded are reporting 15 or more poor mental health days a month. Over 40% of those who are being able to get in some physical activity aren't even meeting the 150 minutes of recommended exercise. And we also have almost 25% that are doing no physical activity outside of their work life.
According to her findings, Rancour believes more needs to be done to help those who help us.
These are all things that come into play that affect mental and physical health and affect your mental functioning on the job every single day.
Hope Toffel couldn't agree more. She's an ICU nurse at an area hospital. Toffel appreciates the fact that Rancour produced this study to bring the plight of nurses to light.
Actually hearing someone say, like, I care about these people and we need to, as a community, care about this profession. It means a lot.
Since participants of the study were anonymous, we don't know if Toffel took part, but she's not surprised by its results.
I've seen nurses go through so much stress and they don't take care of themselves, go through burnout.
Toffel tells us there are times when her job can be a real struggle.
I'm on my feet for 12 hours, running blood, running medications to save this person's life. I stand on my feet. At the end of the day, my back hurts. I don't want to go work out after that. There's times that I don't drink water, and then when I don't eat, it affects my mood.
Toffel believes hospital administrators can do more to promote a healthy lifestyle, especially for those like her who don't work during the day.
We don't get the whole cafeteria at night, so we get minimal choices.
And Toffel says visitors can do their part as well, telling us a few simple words can go a long way.
Going into a hospital, we know it's not your best day, we know it's not your loved one's best day, but just saying thank you. That's the biggest thing.
As for Rancour, she's already met with hospital representatives in the area to discuss the results of her study in an effort to create health and wellness initiatives for nurses.
Workplace wellness is no longer an option, it's a necessity.
It's all part of her mission to give back to people who give us so much each and every day.
We all know that we need them, and we want to make sure that they know that we appreciate their work and that we care about them as much as they care about us.
James Felton, WNEM, TV5.
And if you'd like to look at the study in its entirety, you'll find it in the Thursday Hot Link section of WNEM.com.